A very good afternoon and welcome to our session, Mindfulness Based Techniques and Overview. We are glad to have Senior Consultant Dr. Vijayageetha Pathangae, who will talk about it in briefly. The doctor will also help us understand more about this in detail. Doctor, you have the stage.
Thank you. A very good afternoon, everyone. Another session. The session is completely about the mindfulness based therapy or the techniques that is involved. And if we can recollect, the brief about the previous session was all about how the mindfulness based intervention towards in as an intervening that we see in the session of what we had last week. But little was discussed about the intervention. We all know that any interventional therapy has its pros and cons. We just pick up this is not going to happen, and when there is a we do not know how to move ahead. So we are going to get into the details of this session, the complete techniques and how it is going to be utilized. So welcome to the topic mindfulness based techniques. What exactly is mindfulness and how did it all this originate? So the credit goes to a person whose name is John Kabat-Zinn, and he was born on June 5th, 1944, an American-based professor who's done his doctorate on biomedicals, and he's actually a professor of emeritus of medicine, and he was to be the founder or the creator of the stress reduction clinic, and his therapy or the stress reduction program is actually called mindfulness based stress reduction, so it is shortly called MBSR. So what did he do? He incorporated Zen Buddhist teachings and with the help of scientific methodologies came up with this technique. Okay, and it is since then that it has been offered in various medical centers, hospitals, health maintenance organizations, and there's too many articles, research based publications, and his work that is already coming up and existing. So he was a biomedical scientist and was working in this field of molecular biology, and he gradually was working uh, as a part of a military research based program at a university. The program was studying more towards the Vietnam War, during which time he found out that his work had a karmic assignment. And since there, he was first introduced to meditation by a person named Philip Kapleau, who was a Zen missionarian. And this is where the author picked up the technique of meditation. And he became a student. Through them, he studied insight meditations, and eventually he started teaching from there. Gradually, his profound knowledge made him to come up adapting Buddhist teachings on mindfulness and how it would be elevating the stress is all about the stress reduction and relaxation program, which started stemming from there. He eventually coined an 8-week course, which is actually called Mindfulness Based Stress Reduction. Gradually, he started spreading this curriculum to various centers in healthcare, in medicine, in the work worldwide. The entire aim, which what the author says, is to cope with stress, pain, and illness. And that is possible if one can build up moment to moment awareness. So, though the complete work is available, little that we know how we can incorporate. The author has also been laureated with quite a few awards. One is in the year 2008 from the University of Torino, Italy, Mind and Brain Prize from the Center for Cognitive Science. He has received one. In 2007, he had received a Pioneer in Integrated Medicine Award from the Revel Philanthropic Collaborative for Integrated Medicine and Association for Behavioral and Cognitive Therapies. So let's look into what mindfulness based technique is, but apart from that, how we can incorporate this in our IVF treatment seeking couple was seen. So let's brief up what has been looked into the treatment part. So we knew that the couple would be having a regular visit to the hospital, a regular consultation for monitoring follicular growth or biological concerns with the consultant. That can be repetitive scans, blood tests, medications in the form of injections. So there's a lot of pain involved. So the illness is identified, which the couple is looking forward either for managing a fertility issue or getting treated for an infertility issues. So the illness is identified here. There's a lot of pain. There's physical pain, trauma sometimes. There can be emotional pain and also emotional trauma among these people in this treatment seeking population. And last but not the least, what we are also looking towards is stress. There's a lot of stress mainly because one do not know where the treatment would head to. Will it give a fruitful outcome or a justifiable outcome, or will it give a desired outcome? The answer is don't know. So this leads to a lot of distress. So incorporating mindfulness based methodology as an intervention among the treating couples, we've seen practically, or I've seen practically in my own practicing area, how the stress is being handled, how couple gradually cooperates, understanding the pros and cons and getting into the moment to moment awareness, which what the technique is all about, initially getting into, has built up a very good bondage between the treating doctor and the treatment seeking patient. Thereby the journey has led to fruitful results, if not for a desired result. So this is what is all about, and this is what pursued me to let's get into the deepness about this technique all about. So in brief, the author had done his practice of yoga and his Buddhist studies. Gradually he integrated based on scientific findings. So he teaches mindfulness that would help in coping stress, anxiety, pain and illness. So the MBSR, which is a stress reduction program, is offered in various medical centers, hospitals and health maintenance organizations. Is a little bit of brief which I'm going to go into. What is the course is going to aim? The complete aim is to build in moment to moment awareness. But there can be a simple question. Yes, madam, but how can we achieve that? The session is all about that. First, when there is a treatment seeking couple, or if there is any couple who is just stressed, it can be as simple as a stress fact. There are so many unknown factors. They can also practice. So among the population who is looking not only for infertility or fertility treatment load, even simple stressed people can also practice the moment to moment based awareness. So this is how simple it is. And why are we incorporating? There are a lot of research evidences on psoriasis, on pain, anxiety, brain function, and immune function. So these are the 5 areas where research-based documentaries are available to say, hey, the intervention was beneficial. The mindfulness in medicine. As I say, stress plays an important role, at least among infertility treatments or fertility treatments. Stress is very common, as there are too many answers that easily would say, I do not know, or the chances are 50-50. All that is required is to, let's give it a try. And there's a lot of pain involved, pain from the physiological pain of all the way or the distance that's being covered in traveling to meet the consultant, the pain that the couple would undergo in the name of treatment, either through scans or blood tests or any other physiological monitoring. Then there is psychological pain or trauma, the entire agony of adjusting. Cannot discuss this anything beyond your husband or your immediate surrounding, your environment, your work genre, or if at all your friends or the community where you live in is also nosy sometimes to identify, and there is easily point available to mock you down, and is the severe most environmental based psychological stress that a treatment seeking couple would always face about. So how do you overcome that? So there's a lot of pain. It sometimes leads to also narrowing it down to fertility and infertility treatment seeking couples. And let's see how the mindfulness based technique is going to help. As the technique says, the first building point is moment to moment based awareness. So the technique is all about building awareness. How, when, where, and how are you going to build? So gradually, what I would like to tell my treatment seeking couple is like, the first thing you get up in the morning is what the person would do. Ideally, almost 60 percentage of the population has the habit of you wake up and you offer a small prayer to say thank you for another bright day. So at the moment, just take 5 more minutes to get into mentally recollecting what would be your to-do plans for the day. So as a housewife, she will say that my very next moment is to go prepare lunch, pack lunch for the kids, prepare the breakfast for the kids and the family, and then, well, they will be going and doing their individual work if this is going to be a housewife. So this plan runs in the head. What about a treatment seeking couple? So the first thing in the morning is to reiterate what was the treatment plan and what is a to-do task for the day. So thereby you build in an awareness. Yes, at 10 o'clock is an appointment. I will leave home around 9. I've already woken up. It's just 8. I hardly have an hour to just leave the house. So building moment to moment of awareness not only, builds that can be recognized. If a person questions, why can't for a 10 o'clock appointment I can get up at 9:45 and travel? Sorry, there is a lag time, there is traveling distance, and there's something called unpredictable traffic, so time consumption. So your awareness here questions what is the time that you require for yourself to prepare, what is the time that is required for you to travel, and what is the time that is required for you to meet the doctor, what is the duration of your consulting hours, how do you speak, what do you talk, are you going to talk everything? So all the nuances comes to the picture. So you write in the morning, say about 5 to 10 minutes, and you're good to get out of your bed to go achieve your plans. So this is a small 5 to 10 minutes of exercise that you would incorporate in the first thing that you wake up in the morning. Sometimes people are already working scenario people who get up, who already have their jotted plans, who have a calendar schedule, who have emails to finish the next flowing of tasks, or there are reminders, there are mobile calls, and there are WhatsApp messages and meetings to finish. Well, the list is there of to do. Where are you going to incorporate your treatment regime? Or even it can be anything, and what is the time duration that you need to sideline to allocate, and what is the requirements for that. Now this is brought into your plan in during the day to incorporate that some time which would be your me time. So my me time here is my current going treatment, for which I need to isolate or allocate some time that needs complete dedication. What has happened in this activity? The first thing that if you've identified, it is like a beginner's mind trying to play. One would understand one's nature of mind. So the mind, which is all about your thoughts, and there can be a flow of thoughts, there can be a stream of thoughts, there can be a gush of thoughts, there can be very few, meager, or less thoughts. We do not know. So you're identifying what is the nature of your mind here. So the nature of the mind, sometimes you will like, I'm not having anything to think, so I'm closing my eyes and I'm just relaxing. I've got nothing to do. I might as well forget, actually needs to be tamed up. Of your thoughts. Let's say if you are a working person and you have a streams of work to do, how many of us or you would think about, I am sitting, I'm working, my boss has sent me an email, I am addressing the email, but at the back of your head there's something that's running. I want to eat burger, there's a good samosa smell coming, oh, that person is wearing a very nice tee, I would like to get a earring like that. So your sensory perception is also picking up a lot of information that adds distraction to your working mind. So your mind is actually working, no doubt about that. But how are you going to all these thoughts? Well, that is what it comes up, and that requires a lot of patience. Once you start, I know allocating one work at a time, and then period of time, you would be able to bring in your mind into a streamlined pattern. What does the pattern talk about? Like today, now I woke up. My first thing is to get myself clean. Then the thinking pattern will be I will get up, I will use the restroom, I will switch on my geyser, I would have a brushing and a shower. I would then go to my kitchen. I will start preparing for my breakfast. I would have do this and go on. So one line of streamline thought is there. Simultaneously, because you have eyes and other sensory perception which picks up cues, like there can be a TV running parallelly, or there can be someone's audio hearing that you're hearing from the very next door. It's loud enough that you pick up something from the very next door. It's loud enough that you pick up something to your ears. That can be sensory. You have children shouting, or your family member shouting and yanking. So there is stress picked up from your sensory person, which is your skin. So all this is additional information when there's already one part of work which is going on, and your thoughts are streamlined according to that. What about the rest? You need time to jot it down, to put it to an action, right? So you need to first accept that there are still, despite there are 10 thoughts that's been streamlined, there's still a cloud of thoughts that is running over that. You need to align them. So it takes a lot of patience. And you cannot immediately judge like, oh, I'm a good person, this is not identified. So non-judgmental mind is equally important. Once you gradually start streamlining one by one, it's like you're making strands out of the loose cotton fibers. If you see, there are more hairs, but as your mind becomes straight enough, which is streamlining your thoughts, you will see that your mind gradually starts flowing like a movie, or like one after the other, they go in a organized manner. To build this, it's a non-striving act of your thinking pattern. It needs a lot of acceptance to say, hey, these are all the thoughts, and I have to put it in line. But don't want to do that. And then that thought keeps lingering here and there until it finds a space in the sequence of the thoughts that is getting entertained. So acceptance plays a very important role. You cannot negate or push under a carpet something that you have thought about it and do not want to give an identity to it. So you have to accept that this is what is happening. For I want to eat ice cream. Tomorrow is my college day. I have to get up, go to my college, but I want to eat ice cream. College day over. Now I have gone to the doctor for my scan. I want to eat ice cream. So the doctor says your follicle development is still has to development, ma. So your heart is sunk. I want to eat ice cream. Now you negate. Oops, ice cream. I'm not going to give you ice cream. Already I'm finding it myself low because I don't find an enjoyment or happiness to say yes, let me have my ice cream. So if you see, there's a lot of negation. So for this kind of the mind which runs random thoughts, you need to have two important things. One is accepting that they're existing, and two is to letting go something that has not happened. What happens? You keep on negating this ice cream to thought form. One fine day, let's say it's all raining and you really do not have any work to do, and you're sitting, and let's say the treatment seeking process has led you to pregnancy. So during which the doctor would say you're not supposed to roam around much. So there's less work that gets involved. So what happens? I want to eat ice cream becomes too much. So gradually you are not able to overcome the temptation of the thought. You go and you have an ice cream. Then the impact of the ice cream would have caused a discomfort or illness. And then the doctor says, who told you to do this? Because it has caused an illness among a precious pregnancy. So one's own mind needs to be well arranged. Thoughts needs to be well arranged. You cannot play with a thought. You cannot negate with a thought. You cannot isolate a thought. So what are some of the qualities that has been built in the exercise of your, let's say, 5 to 10 minutes of building your exercises that I have mentioned here? What are the qualities that I have mentioned here? One, to be highly non-judgmental. Two, to have great patience, or gradually you will build in your patience. Three, always see from a beginner's mind. What is this? Why did I think? Do I need this ice cream at this moment? Or can I postpone it to later? Or I can completely forget about it. Then it is the trust. Always trust in the process. You will be exercising your thought sequence in any part or all parts of your life, be it in your home, be it in your work area. So you've already seen the fruitful benefits. So you need to trust the process. Similarly, at least in this treatment seeking scenarios, to reduce the distress. A lot of subconscious stress is created because in most of the scenarios among treatment seeking couple, the answer is wait, we are not there yet. So the waiting period causes a lot of distress because of this random thoughts which pop up, has no answer, and is always being brushed under the carpet. So you need to build your trust to deal with them. Non-striving. Repeatedly see, are there any thoughts that's not been addressed? Are there any events that's not been addressed? Did I follow all the instructions that my consultant has told? Did I follow all the instructions that is required towards a successful treatment? You need to constantly strive. And the two things are the two important nuggets that is going to lead you to success. One is acceptance. Yes, I have done this far. I have little bit more to go, or I am going and I will do it. Also, this is not happening, so it's high time that I drop it or let it go. It's not serving the purpose and it's not meeting the needs. So there's no point in holding on. It's like, for example, to serving suffers the most. So some of the qualities, this 10-minute activity of moment to moment awareness incorporated would build in at least these forthcoming 8 qualities that is very important. Okay, so first exercise which I thought you was, the first thing in the morning is to put in a thought, right? But there are many various kinds of exercises that this mindfulness based stress reduction program has already incorporated into. One is your breathing exercises. So mindfulness breathing technique is first used utilization of one's breath to elevate the stress is one. Two is body scan, second type of an technique. Three is mindful eating. The most important exercise or technique that is used among fertility or infertility treatment seeking couple for a fruitful results. um, the next one is mindfulness based walking meditation, because gradually as one seeks towards pregnancy, the hardcore rigorous activity is not entertained, but you still need to be what is your body during your exercises. Your walking meditation helps to incorporate that. And last but not the least, the mindful stretching. So what happens that? So we will be looking each one at a time. Even before that, let's see if there are any research based evidences that can build in a little bit more of influencing factor for us to follow on whatever is this, either through a breathing or sitting meditation or walking meditation, let's say a eating meditation or a meditation with this stretching, will it have a fruitful result. So the very first research paper was an hypothesis on mindfulness based meditation can have a positive influence in the psoriasis affected people. So the population selected here was psoriasis related cases who are undergoing phototherapy treatment. So among them, there were like 37 patients were identified who are undergoing electroviolet phototherapy treatment, and they were randomly assigned to two conditions. One would be meditation intervention, which is a guided meditation that the person would hear when he is undergoing the treatment, and two would be another group or a control group consisting of the treatment which alone, who will be undergoing the treatment, but there is no meditation that has been intervened. The status of the nature of the the impact of the psoriasis was assessed through the nursing staff who's taking care, through the physician who's taking care, and also evaluations through the photographs of the lesions. Okay, so when the experiment was done, there was a first response point, a turning point, a halfway point, and a clearing point, which means beginning to have an impact. There was a breakup of, there is a sudden change in the treatment line. The patient started recovering faster, which is a turning point. A halfway point where the patients were benefiting and were continue to benefit, and the clearing point which says that the patients have completely benefited out of the treatment. So, what was found out that a brief mindfulness meditation based stress reduction intervention delivered by the audio tape during the ultraviolet light therapy has an increased rate in the resolutions of the lesions of psoriatic lesions in patients with psoriasis. So it has improved. So subsequently, if we see the proportional hazards, there was uh, improvement in the treatment, which was more rapidly seen when compared to the no tape condition, um, either in both ultraviolet UVB rays as well as the post ultraviolet rays treatment. Also, there was a improvement. However, a deeper qualitative study is recommended by the author to look into the subjective improvements also. So the first proof or an evidence to say is that there is an impact seen among people who did nothing but just heard the meditation, and they were undergoing the psoriasis treatment, and there was a people who just underwent the psoriasis treatment. There is a significant improve. Initially we are quoting this as stress reduction. Okay, the next important paper was um, on, let's see, about is there an alteration in brain and immune function produced by the mindfulness based meditation. Okay, so the reported with changes in the mental and physical health in response to a meditation that has not actually been systematically explored. So there was a randomized, control based study where the people have undergone an 8-week training on mindfulness based stress reduction program, and they have applied it in their work areas among healthy people. So we've not taken any health condition based people, has randomly selected healthy people to measure the impact of changes in the brain electrical activity before, immediately, and after the 8-week of training program. Among 25 subjects that were tested, there was an increase effect in the people who had been meditated. Let's look into the result part of it. The report the first time was significantly showing increase in anticipation which are actually associated with a positive effect. So in the meditators, compared with the non-meditators, we found that the positive effect or the brain region associated, which is the anterior activation, was high, and also found significant increase in the antibody titers towards the because they were subjected to influenza vaccine. It was towards the influenza vaccine among subjects in the meditation when compared with those in the control group who had not got the underwent the training program, but they have got the vaccine. The magnitude of increase in the left-sided activation predicted the magnitude of antibody titers rise in the vaccine. So when you see this population, after all the meditation, the influenza vaccine was also given to them, found out that uh, among meditators, the positive impact of the vaccine along with the vaccine's impact was more. So there was more activity seen in the part of the region in the brain which has supposed to develop positive effect. However, since these are very short term findings, and the meditation has produced results, and the meditation has produced results, to undergo added research work into subjective analysis. So two positive promising papers which I have pulled out to say, hey, if you're going to streamline your thoughts in the mind, there's going to be a positive approach. So won't that positive approach help a person who's having a treatment to be seeked into? True, right? So let's look into what are the various exercises that these techniques offer. Mindful based breathing. So this exercise is all about focusing on one's breath. So all that you need to do is to find a calm place, sit in a comfortable position, and you would close your eyes and bring your awareness on your breathing. So that is by mindful focus on the breathing. So as you gradually breathe with your eyes closed, initially you will start noticing there's too many thoughts that's run in your head. Random thoughts just comes from nowhere from the air. And gradually, if you see using breath, let's say like when you inhale, you bring in your air inside your stomach, and when you exhale, you visualize that your mind is becoming clutter free, and there's much lesser and lesser disturbing thoughts come until a stage where you realize that you've completely calm, poised, and you reach a state of thoughtlessness. So this is what the breathing exercises intention is all about, and takes you to all about. For any further details, you can sign up for these programs and probably attend an 8-week interventional program to how do you incorporate. First, they will teach you how to practice, and then how do you incorporate that in your life and move forward. Second is mindfulness based body scan. So again, it is a sitting meditation where a person sits, closes his eyes, and has his focus. The moment to moment awareness is what we were talking about, is on the body. What am I feeling from head to toe? So among infertility treatment or fertility treatment seeking couple, the most common feedback would be, ma'am, after the injection, I somewhere find that there is a kind of discomfort that's lingering around my abdomen. She starts saying for 2 3 days, she says, and I think it is more psychological. By the fifth day, because the doses are high, she would say, no, this is now physiological. So this helps a person to identify physiologically, approaching ailments and discomfort existing in the body. This is more practical, and among treatment seeking couple, this and this reduces their anxiety because of this kind of vigilation or awareness makes the person more vigilant. Oh, there's going to be discomfort, so I'm not going to eat this. I'm not going to eat this. I'm not going to eat this. I'm going to go back to the doctor to know how this needs to be addressed. So these are all the quality pointers that would bring in, that's reducing your stress and taking you more towards the successfulness of the treatment. So the third one is an object meditation. What the authors talks about is a sitting meditation where you sit peacefully, close your mind and focus on one object, and then you gradually meditate. So this meditation is The next one is mindfulness based eating. So this is a practical approach where we give it as an intervention among the treatment seeking couple, where if you are going to eat, okay, now this is my treatment plan, these are the medicines, these are the implications of the medicines, these are the drawbacks of the medicines, and these are the effects of the medicine. So when you analyze the effects and the drawbacks, which is what most of the patient is like, I ate the medicine, after some time I started feeling discomfort here, and then there is a pain there. So gradually the body is also indicating something. Due to their heightened awareness, they're able to bring it up much early. So there is much fruitful treatment, and also the quality eating in that they have incorporated. Like, I'm going to negate on this food. This is not going to set me. This is not going to fall in align with the treatment that I'm undergoing. So there's a lot of changes that they bring into the diet. Has also incorporated a fruitful outcome towards the treatment seeking in the form of nutrition aspect. Despite of doing everything, are we still going correct? Your walking meditation is one meditation which involves movement. What does your mind do when you're walking? You're not going to get disturbed, and you know that your grassland or your walking land is straight enough so that you do not fall and hurt, and gradually have an awareness when you walk. So there is a series steps of instructions that one would follow, ideally to bring in awareness of what is it that you're thinking, what is it that you're processing, what are your thoughts, your feelings while walking. And always you can associate your one objectiveness, which is your treatment. So thereby you would incorporate, is there anything that needs to be addressed, is there any thought that is being brushed under the carpet, is there something that's getting negated, would all come to the picture. Last but not the least, what the author talks about is mindful based stretching. So involves a series of stretching activity which he is incorporated from the Hatha yoga, and gradually as one stretches, one would try to identify the thoughts that's running when you're doing certain postures and exercises, and addressing going to the same. So with bunch of these kind of interventional activities, what actually happens first, the primary thought automatically that comes to a person is anxiety. Okay, the doctor has told this, what am I supposed to do, how will I do, if I do this, will it happen, will not happen. I've been instructed to eat a fruit a day. What will happen if I eat? What will happen if I do not eat? What will happen if I do not find a fruit? How to go about that? Is it mandatory? So there are too many thoughts, right? So basically the state of anxiety among any treatment seeking couple or treating couple is too high. Along with that is too many hormones that's been given to them, adds to their anxiety level, practically speaking. So the component in this, which is mindfulness in this topic, because it reduces most of these mushrooming thoughts that worry, thoughts of distress, thoughts that has no answer. And it helps the person to focus or bring their attention to the present one. Okay, at the present, I'm going to my consultant. Today is my monitoring day. Let me get myself monitored. So thereby their emotions and the tendency to worry and to ruminate reduces. Once it's scanned and once we see what happens within the body, you are able to be at relief that yes, my body is responding. We are actually going in the path and it's going to give it to you some result. So the mindfulness based stress reduction here, which is actually an established program, shows a reduction of symptoms predominantly of stress, of anxiety, as well as depression. And it is believed to alter your emotional responding by modifying your cognitive affecting processes. So your cognitive behavior, when it gets modified, the associated emotional factors, you have a relaxed rather than stressful journey. So, what is this practice is all about? Irrespective of what is the nature of meditation that you do, irrespective of what is the kind of focus that you are building in, irrespective of how much ever is the awareness, it indicates the same pain. It is all towards the same treatment, and it is all towards an unknown outcome. So, paying attention matters a lot. It is a slow point, but it is the most important point. Medical history with all the jargons, which is too high that it can be overpowering. Pay attention. Notice down the small, small things. If you've not understood, ask for it. If you've not, let's say, while you're putting it into practice, did doctor tell you to eat the tablet in the morning or in the afternoon? Is it before food or after food? Ask. So, paying attention is rather a slower process, but this is the most fruitful process. If you do not know, do not hesitate to call for help. Live in the moment. Since the presence in the reality is very important, and there are too many informations that your system is trying to assimilate, and it is, to intentionally bring upon many things that ultimately what you're supposed to do and what you're supposed to refrain from is only the two things. So your entire information assessment would go either in accepting it or discerning it and to do how to do, right? So you are living in that moment. So when there is a plan that comes up to say this is what your treatment is and this is what your next 10, 15, 20 days or your 2 months is going to be for that dream to come true towards a success would be charted very equally to say that you are living in that moment. Today my hormones is highly imbalanced. What needs to be done? Nothing much needs to be done. It's very subjective. Will it do good? Because if I am trying to modify this, learn to add more details, probe by paying more attention. Accept yourself. There is not 100% foolproof method to say everybody comes in, we do treat everyone, and then everything is for everyone. No, in every part, just like anybody would say, the treatment is always a 50-50. How much you put on, it actually adds on to your positive percentage. So treat yourself the way how you would be treating others is one line to say you want to feel good. See that what are the questions that is pulling you down, you get an answer. You cannot have one thought in the head and then you ask the other. Let's say you wanted to ask a doctor about the most common thing. Women are undergoing a lot of hormonal changes. So a common question would be, you would be subjected for a lot of hormonal injections during your treatment. So the women would be thinking, oops, now will I put on weight? Would be the first thought that's running. Will I put on weight? Will I gain weight? Will I lose weight? Would be the first thought that's running. But she will not say because what would everybody think? Because whoever I see who have undergone IVF treatments is all become, increase in size and weight and all that. Is it relevant to ask question? That itself is a stress. So, accepting whatever it is, when you ask the doctor, it's simple that you ask, will I put on weight? Not necessary that everybody will be put on weight. The treatment response is very, very subjective. It is always from person to person. There are people who have come, seek the treatment, became pregnant, and they've lost all the weight. There are people who have come, seek the treatment, became pregnant, and they've lost all the weight. There are people who come, seek the treatment, come was highly subjective. We do not know. So accepting yourself is very, very important. And how do you reduce or elevate your stress? Or let's say there's a gushing of thoughts that comes in. I do not know where to focus. You always focus on your breathing. So focus on your breathing to elevate down your random thoughts, to calm your mind, and that's the most initial way to add on, to focus or elevate down your random thoughts to calm your mind. And that's the most initial way to add on to focus or awareness in the particular area. So this is all the practice is all about. So when we develop, as we develop in this meditation process, what we see among the people who practice or intervene is the intention to cultivate an awareness. That is, they go back to do it again and again, and attention that is occurring in the present moment, and the attitude that is, a non-judgmental, curious, and kind attitude that you get out of it is what is developed among the people. And this is very beneficial qualities that one would have among treatment seeking people, because intention is all would want to get better, get what they want, and You obviously need to pay attention for the minutest details for a successful treatment. And obviously there is an attitude on how you take it forward. You cannot throw things left and right and say that, yeah, we do take IVF treatment, but I'm not going to pay attention to all that. That is not the right way. So the techniques which is very beautiful in this program, which is coined by uh, John Cabot, is that the what a person develops out of all this practice is completely transforming. Last but not the least, let's look into some medical benefits. As I mentioned, there is seen decrease in medical symptoms, there's improved self-care, there's greater ability to manage anxiety and depression. Sometimes there are multiple IVFs that has been forced by some people to undergo. In such cases, they do not lose and get into negative habits, and they have always improved in their symptoms. There was even when then there are burnout situations in their life, they have improved from that. Their cognitions are clearer, their attitude or mood change is much better, and sometimes it's very less reactive despite their hormonal levels are higher. So whenever there is a difficult and unwanted thoughts and feelings, there is always a different perspective through which is being inculcated and developed, and the perspective that brings in a sense of compassion, less judgment and suffering that is one is being experiencing. So there was this feedback from one of my patient who would say like, you don't know, madam, I never used to like injections. I have never been through injections from my childhood because I don't like. But the moment my dream to achieve pregnancy is more important, I have somehow accepted this prick and pain, and I've always of joy. And you will not believe, after a transforming thought, the benefits are higher because the emotional entanglement around the activity is much less, which says nothing but improved sense of well-being. So when a person learns to accept the present reality, appreciates the simple things, and connecting with that to oneself, and that is a greater experience of what is it being to be alive. So on the whole, what I have also seen among the meditators is that there is a mindfulness in their body, there's mindfulness in their feelings, there's mindfulness in their mind, and it's all about the knowledge that they one try to incorporate. See that the knowledge is coming from a relevant source. For a person, he can be seeking his religious understandings from being a Hindu, he will seek his religious understandings from Hindu scriptures. If the person is a Christian, he gets his religious understandings from his Christian scriptures. So what is more holistic, or in understanding themselves? Many people have told that I am having I do read my holy book every day, like a Quran every day or my Bible every day. But moment they have brought in the mindful practice, their way of approaching the scriptures has much more evolved and improved. What is being achieved here? The positives that's been heard, the transformed mind, the guts that the lady would say, yes, I would love to undergo the pain that would be converted as flowers of joy. What is happening to this population of meditators when they are meditating or incorporating an activity in their everyday life activities is nothing but they're improvised in their mental faculty. So which one would also call it as an inner wealth. They are mindful, they investigate. If there is no answer to a question, they're always aware of their energy levels, because when they sit and think about their body, the discomfort is here, and there's a discomfort there. I need to look into it. Why did I sit prolonged? Did I eat? The head is paining. Did I look into my monitor too much? So there's a lot of awareness with a lot of focus. They investigate. They are more aware of their energy. They're all joyful. Then there's also tranquility. There's greater concentration and equanimity. So So, due to the increase of awareness and focus, the concentration factor is also higher, which is what has been seen. So, are we good to go? As said earlier, the aim of mindfulness is to stop that arising, those disturbing thoughts, emotions which arise from the sense of contact. You see an image or you see a previous patient, she's already crying from the injection area and coming up, "Oops, my injection will also be the same." No, this brings in a stress, but when you investigate, when you're going to probe into it and you take relevant steps, I don't think so you might be crying, you'll be coming out joyful. So, can one achieve good health? So, the answer is in your hands. And I would also look into from the spectators like what else is being done that can be looked into for a much better good health. The most important factor is to be mindful. So, incorporating will bring in a lot of benefits. Your benefits are your benefits. So, be mindful about it. Try to meet your seniors or your whoever you're seeking your spiritual knowledge from, to see that you are well aligned to move forward. Your best ones are your counselors who are guiding you into such therapies and techniques to move forward for a self beneficial initially. This is what I would like to say. So, to know more about the author or the influence of what he has given to the society is already brought through in various techniques. Last but not the least, his complete mindfulness based stress reduction program was addressed through a book called Full Catastrophe Living. It's a revised edition. So, if you can go through the book, he has given from pin to point. The cover to cover book carries complete details of how one to cope with stress, pain, illness using this beautiful meditation, which, as a researcher, as a person who tries to incorporate such intervention among the people, found valuable benefits among the treatment seeking couples, which has motivated me to share the beneficence of these techniques and therapy. So, with that, I would also look into some more information that would be beneficial, how this has helped. The impact is the mechanism. So the act of bringing in by either in from the pain which we see, it has brought in decreased perception in the pain severity. It has increased the tolerance level. Can we put it this way? The stress is reduced. The anxiety or the depression is much handled. There's the diminished usage of the adverse effects of medications, like an antidepressant or a stimulant or anything. There's enhanced ability in the choices regarding increased motivation. There's much better lifestyle, activity, and behavior. We've also seen altered biological pathways in health, specifically in the autonomous nervous system, the neuroendocrine functions, and the immune functions. And most of these possibilities, though are not rigorously examined, nevertheless, there's a lot of psychological stress which is linked to these medical conditions have improvised. So, though the research based through these processes are basic and minimal, they are sufficient enough to trigger much more deeper analysis. And last but not the least, try to incorporate. If anybody would like to know more about the therapy, you can go through the book and you can incorporate, but don't be completely freelancing and get into the things. You definitely need somebody to help. So the ideal thing is to enroll yourself for such program to look into what needs to be done to elevate it, so that you can have a very good health span and more my psychologist. If you want to incorporate in any other areas of life, find a relevant psychologist and get your monetary moments monitored. Thank you for listening.